good day. Although I've come late, and at times when you have issues, you are working, you are going here, you are doing that. Sometimes you get yourself tangled up in some things. So don't worry yourself, no worry yourself, everyone. This is a good day. Here I'm from Kenya, and today is on a Wednesday. Wednesday, we used to call it Ladies' Day. Wednesday, Ladies' Day. And you remember what we discussed? We're going to start talking about some other types of heart diseases. Dilated, when the heart muscles are thick and are dilated. Thick is different from dilation, because we have hypertrophic, dilated, and the others that we saw. So we will start the first one, which is dilated cardiomyopathy. Dilated cardiomyopathy. So as I welcome people, welcome to the chat, and you can ask any question. Today I've come so late. I can see Simple Kate. Today I come here first. Simple Kate, I'm from Chiki. How are you, Benjamin? I'm fine. I've been busy till morning. The day that you see me with this, just know I'm from You understand? Doing some things here and there. So welcome, Simple Kate. And nowadays, I don't. My time is not constant. I usually have time at 4:30. But nowadays I have because you never know what time will come. You'll have some time. I have so many clients, and I thank God for them. I help them. Now, cardiomyopathy is apart from heart diseases, rheumatic heart diseases. We have had other problems that the heart itself undergoes, and these things are there. So today we will start with the one that we discussed, that is called dilated cardiomyopathy. When I say cardiomyopathy, I mean blessings for the good job. May God give you more strength. We need you strength. Simple Kate. And very soon you are seeing me. I think next month. Next month it can be. I'll take some off. And we were discussing with Uncle when we are meeting. We will come. I think Simple Kate stays around Nanyuki. We can have a road trip one day, then come back, fly to the village. So Simple Kate, maybe we'll meet soon. And thank God you are my friend. Me, I'm a friend to everyone. So big up yourself, everyone. Welcome to the channel. And as you come in, and I can't wait. Simple Kate, if you meet me in Jamaican uncle, you'll be tired of laughing. We usually laugh continuously, making good jokes. And when we are in the car, reggae music plays constant. Maje, how is the going in Jamaica? Maje is a good lady, man. Maje is my friend. She has been my friend for some time. Today I'm coming here live at 6 p.m. Kenyan time. And I thank God for the time that I have got coming to meet my guys and interact with you guys. So if you are a new person to this channel, what you may do is just subscribe and tell us where you're watching from. Sometimes when you go to a channel and you're a new person, you don't just swipe. Go to that chat. We have some people in this chat that have channels like Simple Kate have a channel, and others that may come. Go follow them. We love you so much. Trust you. I'm a reggae girl too. Thank you so much for being that. People that love reggae have good heart. We are very hot, but thank God we are alive. Yes, thank God we are alive. True. Always be satisfied by what God has given you, and work slowly hard to where you want to be. Yes, where you want to be. So we were discussing about heart complications, and there are other groups of complications of the heart people don't know, and they are affecting people all every day. Yeah? You are always getting chest pains, you are always getting high blood pressures, and you don't know you have this. And I realized there are some even health workers that they don't know these problems are there. So you go to a health worker. I have green tea today. My green tea is back. Mm. You go to a health worker, the health worker finds out that your BP, your blood pressure is low or is extremely high. Gives you medication, you are never getting better. But the health worker doesn't. It continuously gives you drugs. And then at the end of the day, you are told you have resistant hypertension or hypotension. These groups of diseases that we are discussing, I'll give you a big hug for being a good dad, husband, doctor, regular, our friend, the list goes on. The only thing that you have never seen is her. She is never wanting to come online. She's very shy on camera. She tells me, no, 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 that's your thing, not mine. Yes, but at times she takes here. No worries. One day you'll see her. And so I'm saying that, but when you are done due diligence, you find that you have cardiomyopathies. Have you ever met someone that the the blood pressures are always high? The blood pressures are constantly high. Even if this person is being given medication, we'll find that the blood pressures are just constantly high. There are some groups of diseases that are there, like these cardiomyopathies, that people have, and they go to hospital and they are never known. Hmm? Cardio is the heart. Myopathies the diseases of the heart. So today we are coming to talk about these diseases of the heart, starting with dilated cardiomyopathy. Dilated cardiomyopathy. Now, cardiomyopathy, as we discussed, we don't take these words as complicated words. No, cardio. Anytime you work out. There are some working out processes that you're told that I'm working for my cardio. You want to strengthen your heart muscles. Cardio, the heart. Myopathies are problems, diseases. So when I'm saying cardiomyopathies, just understand I'm talking about diseases of the heart. But there is this one that we are starting with that is called dilated cardiomyopathy. Is a group of heart muscles disease in which the heart, especially the left ventricle, this is where I start drawing. I start drawing. Welcome, my friend. Welcome. I'm happy to see everyone. I'm happy to see Magic. I'm happy to see Simple Kate. You, and I'm seeing some people are watching, and they are not saying I'm watching you from this place. If you are watching, my friend, just say you are watching from here and there. Leave your message. So cardiomyopathy. Let's draw the heart. Let's draw the heart. Let's draw the heart so that I can explain the cardiomyopathy. These things called cardiomyopathy. So how has been your days? Wednesday is that day we used to call Wednesday. We used to call it. What? Ladies night. Ladies night. I'm looking at this heart so that I can draw a good heart. We used to call Wednesday ladies night. Giving thanks to lovely moments you have. I want to draw a perfect heart. So let me look at this so that someone cannot confuse this. Pulmonary artery, and then it comes like this. Okay, let me check this out. I'm drawing the heart so that I can explain dilated and dilated. Did you smile today? Sam Panda, make a like that. My name is Sam. Sam, how are you doing? How are you doing? Now I am drawing the heart. I'm drawing the heart. I'm drawing the heart. I am drawing the heart. Sam, did you smile today? Anyone who smiled today like me, I usually smile every time. Every time. Sometimes even when I'm so angry, someone has done something and is annoying. Great brother. Thanks you for being great. I'm trying to draw a heart here so that we can discuss something that is important. We can discuss something that is important. Like this, like that. So now let's understand this heart. Let's understand this heart. Did anyone smile today? You know, smiles make you young and they make heart diseases to go. If you want to make your heart diseases to go away, just be keeping yourself with smiles, keeping yourself with smiles. Yes, you don't get moody because serotonin release in your brain makes you what? Younger. Yes, if you want to be young, avoid hate and smile every time. It makes you be young and young. So we have said, I've drawn my heart. Ahmed brother said me, you doctor. Oh, Ahmed. Ahmed is my friend. Ahmed is my friend. Now, dilated cardiomyopathy is a disease of the heart which, especially the left ventricle, becomes enlarged and weak, making it difficult to pump blood. Now, let's look here. This is your heart. The red part is oxygenated blood from lungs. Here, it is deoxygenated. So, imagine, where is the green one? This one. It is enlarged. So the space here becomes little. The amount of blood that comes in here becomes less. So pumping becomes a problem. You are pumping less blood. And that's why it's called dilated. This part here, this is the heart muscle. This is the heart muscle. If you look at this one here, if you look at our heart here, look at this heart. If you look at this heart and you look at this heart, you will see this one is dilated. It has thick muscles, but these muscles are okay. So it is called dilated because the muscles are thickened. And it makes you have less blood. Do I have a sticker? I don't have a sticker today. I want people to look at that heart. Look at this and look at this. You see, this one is normal, but this one's the heart muscles are dilated. They are dilated. They are thick. The muscles are thick. When you see with drawings, you understand. You see. Now, brother, can you give me a small tip for the health? Because I'm eating so much. My current weight is 80. I want to lose weight. You want to lose weight? If you want to lose weight, don't eat any carbohydrate. Eat protein alone. Even if you feel dizzy, just eat proteins. Proteins alone. It is called keto diet. After 1 month, you'll have lost half your kilos, your kgs. After you will lose weight. a lot. Just do keto diet, but you will feel dizzy. Dilated cardiomyopathy. So heart disease that makes your heart muscle to be bigger. Is most common type. This is the most common type. The normal heart first. Now, if you compare, let's compare the normal heart and the dilated cardiomyopathy. The normal heart plus the dilated cardiomyopathy. Let's compare. Guys, if you're coming in, please, you don't come in and just listen. Come in and hit the like button and do what? And also subscribe. Let's compare these things. Now, this is my dilated heart, and this is the normal left ventricle. So my dilated heart, normal chambers, they have, you see, they are normal. These chambers are normal. This heart, these chambers are normal. These chambers are normal. But look at this. One of the chamber is very thick. It is very thick. They are very thick. You see, this chamber is very enlarged, and this one is smaller. Enlarged chambers. And normal heart has strong pumping power. It pumps, pushes blood, pushing blood. If you are watching me, please tell me where you're watching me from. Tell me which side of the world you are watching. If you are new, don't just go, my friend. Leave a like and subscribe. Hit your subscription button. Let's go, my friends. Subscribe to the channel. So the normal blood ejects 55 to 70%. If the blood is pumped here, it removes 50 to 70% of the blood. Is 55 to 70% of the blood that is pumped to the heart. But now, if the heart is looking like this, it will be less than 40%, because you know this one is dilated and this one is thick, less and enlarged. So you will get to the body less blood. Normal blood flow. You can have a normal blood flow with this one. But with this one, reduced cardiac output. So the cardiac output means the amount of blood that is coming from your heart. This one has thin walls, very thin walls, and this one has stretched walls. You see, so what happens so that you can get this problem? What happens so that you can get this problem of cardiomyopathy? Heart muscle cells become damaged. The cells of the muscles here are damaged. That's why they are stretching and enlarging. The ventricles are this one. They enlarge, they become bigger, they become big. Blood backs into the lungs and the body. So when these lungs are pushing to these lungs are pushing, this heart is pushing blood. Instead of blood going, all of it, some comes back. Some comes back. Even to the lung. The normal way the heart pumps blood is, I'm a veg, what can I eat for diet which protein helps improve my health? You can eat beans. There are several legumes. Beans have proteins, legumes have proteins. Eat legumes. If you are a vegetarian and you don't like proteins, don't eat meat. Eat just legumes. Now, look at this. This blood, blood is pumped, goes to the lungs, and then comes back, goes to the body. Hey, J Hank, man, how is the going? It's a Wednesday. It is a Wednesday. How are you doing, J Hank? So, heart muscles become damaged, the ventricles enlarges, and contractility decreases. The heart has to contract to push. The heart has to contract to push blood. It reduces. Heart failure develops. This follows something called Frank-Starling's mechanism, where initially stretching increases contraction. You see, Thanks, Dr. Brother. Thanks you too, Sam. Stay around. Don't go and share the live. If you have any question, continue asking. Don't just. But excessive stretching eventually weakens the heart, because when this is stretching a lot, the strength of pushing blood decreases. You don't now. Well, I'm good, thanks, bro. Nice one. I'm pushing today. I've come late because I was a bit busy. Hope you are doing good in Thika. What are the causes of dilated cardiomyopathy? Inheritance. Some people inherit these problems. Mutations of some proteins in the heart muscles. You know, heart muscles are proteins. So the mutations inherit proteins that are mutating. Mutating is changing from the normal to something that is not normal. Has a problem. Guys, just a minute. I take something here. Yes, I'm back. Now, mutations we are talking about, please come to my live. Oh, you have a channel. Okay, I'll check it out. 6:45 night, morning, 6 only, Saturday, Sunday, and afternoon. Oh, if you have a channel, I'll visit it. Don't worry. So, mutations are those proteins that are changed to something else, and then they make the heart muscles to be something else. Heart muscles become something else, you know. Something is disturbing you. But my brother, see you soon. No problem. Just leave me your subscription. I'll check you out, and a message. Now that I know you, I'll check you out. No problem, bro. No problem. Now, we were talking about the mutation. There are some things that are... someone is laughing at me. Who is that laughing at me and giving me some laughs? Now, first thing that causes your heart muscles to be big and dilate, because we are talking about dilation, is mutation, which is genetic. But there is coronary artery disease. Rapid heart attack destroys the muscles. We talked about heart attack. Rapid heart attack destroys heart muscles, causing ventricular dilation. They cause the ventricles to dilate, the ventricles to become bigger. The ventricles, this is the heart. Here, this is the heart. So these ventricles become big. Coronary artery disease. Heart attack can make you, several heart attacks can make you to have this problem. Your ventricles are big. You have sometimes you have seen people that have gone to hospitals and they have told you have a big heart. It is because the doctor does not know how to explain to you as a layman you have dilated cardiomyopathy. So if you hear someone has a big heart, just know the doctor is trying to tell that patient you have dilated cardiomyopathy. There is something that is called hypertension, high blood pressure. If you don't know how to control your blood pressure, you are always resistant to be taking the medication of the doctor has advised you to take medication, you don't want to take medication. And you say, you know, I always take medications when I feel that I have a problem. You know what you are doing to yourself? What you are doing to yourself is you are making yourself very soon having dilated cardiomyopathy. Reversing that is a problem. reversing that is a problem. There is infections like viral myocarditis. People that have in flu, SARS, COVID, adenovirus, those are viruses. You remember when we had COVID, many people till now are still taking anti-diabetics drugs, and some are even taking antihypertensives, because the virus destroys the heart muscles, and it made the heart muscles to be bigger. It made the heart muscles to be bigger, and they ended up having this problem, dilated cardiomyopathy. And when it ended up to be dilated cardiomyopathy, now reversing it is a problem. You see, and that's why when you have some flus that are not even healing, you need to go to a doc. You have a flu, and then you say, I know I have a flu because my BP is high because I know I have a flu. Yes, please see a doctor. So the inflammation, when the virus attacks you, it gets to your blood, and then it gets to the heart muscle. It destroys the inner lining. It destroys the inner lining, and then your heart becomes this way. Your heart becomes this way. No, because it is stretching, and it's because it's because of the flu that you have. It's because you have a flu. It started as a flu. I've seen some people that, let me tell you one thing. It can start as a flu. You end up having rheumatic heart disease, because it can be a bacterial one, flu, or it can be a viral flu. So when it becomes a viral flu, the persistent viral flu can damage your you hear people talking about endocarditis. You hear people talking about rheumatic heart disease. Endocarditis because of smoking. It's because of the inflammation of the inner lining of, even a virus can do that. So without proper treatment, my friend, viral myocarditis, when you hear myo, it's muscles and inflammation. So it destroys this inner lining until your heart becomes this way. When your heart becomes that way, what happens? The capacity of pumping blood becomes a problem. So you end up on drugs persistently. I can see more people coming in. Please leave your like, and if you are new to the channel, don't forget to subscribe. Hit the subscription button. Yeah, let's grow. Let's be bigger. Let's be big. I have noticed so many people are watching videos and they are not subscribed, but it's okay. At least they are fans, even if you have not subscribed. Now, let's go on. There is something else that can make you have that problem. Nafula Lateli. Nafula, how are you doing, Nafula? My sister from Western. Even me, I'm from Western, you see. So Nafula, welcome to the platform. Thanks for being here. We are talking about heart diseases and what can bring them. So you can have alcohol. Let's see. How many of you take alcohol? How many of us take alcohol? How many of us? For me, I don't take alcohol. I don't like alcohol. But if you are proud of what you are doing, who takes one for the road? Before I say what I want to say, who takes one for the road? They say, I usually take one for the road. One for the road, my friend. One for the road, my friend. No one wants to say, I take alcohol. Please tell us who takes alcohol. It is bad to use alcohol to wash goodies. Is it bad to take alcohol to wash goodies? Which goodies? Fruits. Nafula, are you saying you take alcohol, you wash fruits, like fruits you eat? When you go to the way I see people taking What is it called? I've never understood. I don't take alcohol, but I go listening to music in clubs sometimes when I'm tired and I have friends that we are going with. So what I'm asking is the way they take alcohol and then they put what is it called? Citrus, a fruit there, or orange fruits, or what do you mean? Is it bad to use alcohol to wash goodies? Make me understand. Make me understand. Okay, no worries. Let's continue. I'm asking who takes alcohol before I say what I want to say. When you ask who takes alcohol, everyone becomes silent. Everyone goes silent. You don't want to say I do. Alcohol. Who takes alcohol? What are goodies? What are goodies? What are goodies? Nafula, what are goodies? Let me know. Let me know what are goodies. What are goodies? Yes, let's go on. Heavy heavy alcohol intake for many years is toxic for your heart muscles, oxidation, several problems occur, and then you have problems, problems that you cannot stop having. Fatty liver, fatty accumulation in your heart. So alcohol with your heart is not a good thing for many years. And I want to ask if you know of any advantage of alcohol, please let me know. Any good thing that alcohol can do, please let me know. Nafula is what is it what I'm thinking about? Simple Kate, please let Nafula elaborate. I want to know what she is saying. Now, okay, because when I go to clubs at times with my friend, I see them bringing a cup of alcohol with some fruit on top. So is that washing or what they're doing? Oh, hey. Now, the other thing that can make you have this problem, dilated cardiomyopathy, other problem that can make you have dilated cardiomyopathy are drugs. Drugs like doxycycline, those are chemotherapy. So people that are undergoing chemotherapy, they may have dilated cardiomyopathy. They may have these problems, And women also, when you are having something that is called peripartum cardiomyopathy, it means during pregnancy, the last month of pregnancy, up to 5 months after delivery, the heart is really struggling to pump, and many ladies you have seen there having high blood pressure at those months. They get this cardiomyopathy because of the stretching and inflammation, especially the ladies that don't visit. Those ladies that don't visit, Yes, I'm looking at something here. Especially the ladies that don't visit ANC clinics. You go late for ANC, and then you have you go late, and then you start having high blood pressure, and it is coming through dilated cardiomyopathy. It is harming your muscle walls. Jay Hank is laughing. Please, people, let me understand what you are laughing. Nafula, what are people laughing about? Please, let's understand about it. Let's understand. Cocaine and amphetamines. These drugs damage the inner lining of the heart. Cocaine and amphetamines, including alcohol and chemotherapy drugs. The myocardium, and increase the risk of you having this. So those people that take coke. Greetings, Dr. Ben and Chat. Chat Travels. How is the going? How are you doing? Welcome, Desease. Today I've come late. It is 6:36 p.m. Thanks for your like. Big up every time. Thanks for your like. Today I'm talking about cardiomyopathy. And the kind of cardiomyopathy I'm talking about is called dilated cardiomyopathy. These chambers of the heart becoming bigger and the muscles becoming thick and bigger. See, so the capacity of pumping blood is not good. You kind like you're pumping blood that is going and coming back, going and coming back. You know, the purpose of your heart is to pump blood to go to the body. But when it is getting blood, but the blood is being pumped, when it's going here, then it's coming back. Only a few liters are going to the body. It's not good. It means that low turn-up of oxygenated blood in your body. Low turn-up of oxygenated blood in your body. So you start having dizziness, you start having issues, you check it out. Nafula, I'm still waiting. I've asked you what are goodies. Hey, I've just remembered something. Nafula, are you asking, is it okay to wash the vagina with alcohol? Is that what you are asking? Well, if it's that, please confirm if that's what you are asking. Is it okay to wash the vagina with alcohol? Is that goodies? Let me know. Let me know so that I can advise accordingly. I don't want to advise things that are not asked. Oh, so nowadays it is called goodies. Okay, now it is not okay. It is bad, very bad. It is very bad. What is alcohol? Alcohol at times, yes, simplicate. Alcohol at times is like a sterilizer. You know, it's alcohol. It dissociates cells. So down there, you have some bacteria and some things that help you there, the pH there to be normal, to be the way it's supposed to be, so that you cannot get vaginal candidiasis. So you, because you want to be very clean, you take alcohol, you bring it there, you wash, and then you start itching. You start itching because you have removed the good bacteria, you have removed the mucus layer that is protecting abrasions. It is not good. It is not even good to put there things that the doctor has not advised. So if you have a problem, you just wash well with soap and water, the way you know, and also you can wash with soap with only water, unless you have maybe if you have something like what you are undergoing a disease, UTI, several down there, pelvic inflammatory disease. What can someone use to dry out excess mucus? Cotton wool, tissue paper, approved. They are called wipes. All those ones. So don't use alcohol. You will destroy. You will start. You will get vaginosis, fungal vaginosis, or you will start having candidiasis, So let's know like to prevent expression of excess mucus. Nafula today is asking questions, gynecological questions. Excess mucus. When you are Nafula, when you are just seated and then the mucus are coming out because you have called them the mucus. They are secretions. Or what do you mean? You know, they come out when you are thinking about something, or you are indulging in something, or you are excess discharge means maybe you have an infection or something wrong is happening. So if it is excess secretions, you have to see a doctor because there are several things that happen, especially when it is excess secretions that have a color like yellow, bright red, brown, those colors, green secretions, you have to see. But excess secretions when you are making love or having your man, I don't see it's a problem. It's a God blessing. That is God's blessing. You cannot prevent it. So you enjoy God's creation. Or is it when you are just seated? When you are seated and you are just having discharge. You know there is there's two ways when you are seated and you are having discharge. You are just seated and discharge is coming out. That one is a medical problem. But when you are doing something and it is excess, we thank God because that is creation. Okay, answer that question as we continue. So we have said what can cause those problems to your heart muscles are alcohol, viral myocarditis, viruses, bacteria, coronary heart diseases, heart attack, pregnancy, the third trimester can make you have these problems. Pregnancy. Okay, we have something that is endocrine disorders. People with hyperthyroid or hypothyroid can have this problem, and diabetes mellitus, diabetes. Some people with diabetes can have this problem. So let's continue what can pray. Autoimmune diseases like rheumatoid arthritis. Rheumatoid arthritis is an autoimmune. Autoimmune meaning your cells of the body fighting the same cells of the body. Autoimmune. So sarcoidosis, systemic lupus erythematosus, systemic lupus, all these are autoimmune. So they may attack the heart muscles and then you have the problem. So that one you have not brought for yourself. It has come by no chance. It has come by idiopathic dilated cardiomyopathy. Those are people are just born with them. People are just born with these problems. Idiopathic. Idiopathic means we don't know what has brought it. You were just born with heart muscle disease. Heart muscle disease. Nafula, you have not answered me the question. I've said if you are just seated and it is coming out as discharge, especially when it is having color, just know that one needs attention. But when you are doing something good, just know, and that is life. Just know that is good. Hello, doctor. Coffee cakes. How are you doing? We are talking about dilated cardiomyopathy. The heart muscles expanding, becoming bigger, and the heart chambers. You see this heart? This heart, it doesn't look like this one. This heart does not look like this one. This chamber is very big. This one bigger. This one is very small, and the muscles are thick. The muscles are thick. So, Navula, please answer that question as we continue. Possible symptoms. How can you know that I have this heart problem? How can you know that you have dilated cardiomyopathy? How? Fatigue. Sometimes when you climb stairs, you feel you are so tired, you can sit on the stairs. Why? Because you are not getting enough oxygen to muscles and brain. Your heart is not pumping enough, and sometimes shortness of breath. But you know, when you are having it, when you pump, some blood goes, comes back. So signs and symptoms. What are the signs and symptoms? Fatigue, reduced excess tolerance to exercise. And when you go to the gym, you feel you are tired, you are trying, but if you are not getting oxygen, of course, in the background, no problem, chat travels, no problem. Mild shortness of breath. Sometimes you have shortness of breath. Those are signs that you are undergoing cardiomyopathies. So let's talk about this thing that is called how it progresses. Left side heart failure. When it is in the left side, you will always feel breathlessness when you are walking, because this is the side that is giving you oxygenated blood. If it is right-sided, leg swelling, abnormal swellings like the stomach, you feel someone has ascites, the abdominal swelling. So when you are swelling the feet, just know the right side, the vena cava, this side, blood is not coming to the heart and going, it's lodging to your legs. So you have seen people with heart diseases, their legs swell. Their legs swell. Why? Because they have right side heart failure. And then low cardiac output. Your cardiac output means the blood that is coming out of your heart. Fiona, hey, the lawyer, student. How is Uganda, our lawyer, our student lawyer? Fiona is studying to be as lawyer, and you guys, you should visit. I usually tell people, everyone, to visit Chat Travels, Fiona, Simple Kate. Who else? Let me check who else is here. Coffee Cakes, J Hank, all these people that are here. Some of them have channels. Visit them. Please visit them. Please visit each other. Don't just see a person is online. Nowadays, a person cannot stay like 20 minutes or 30 unless you are very busy without touching the phone. And then you see Fiona online and you don't want to listen what Fiona is saying. You see Chat Travels online and is your friend. Just click and you put it there. You see, it is called supporting. You are a pillar of support to your friend. A pillar of support to your friend, Okay, low cardiac output. It will make you weak, business, cold hands and feet. Sometimes you have very cold hands and feet, very cold hands and feet. Arrhythmias, palpitations, your heart beating so fast. So when someone is done physical examination, you see the heart is very big. So if you touch here, you will not hear the heart beating. Maybe you will hear the heart beating here or here, down, displaced heartbeat. Your legs swelling. Sometimes when you hear with a stethoscope, you hear that's called regurgitation. So when someone is breathing or is saying I'm having chest pains, don't always say that you have pneumonia. No, it may be from your heart. It may be coming from your heart. These things. Yes, Nafula, you have not answered me. I'm still waiting. Raised jugular venous pressure. Sometimes you see these veins are dilated. They are so dilated. That person is undergoing problems. So if this problem is not treated, what can happen? Heart failure. The heart stops pumping blood well. Arrhythmias may lead to sudden cardiac output, cardiac death. Blood clots, because when they are stretching, the blood can start clotting, because the factors of clotting factors are not active as always. Poor concentration causes blood stasis, especially in the left ventricle. Poor contraction, not concentration. Poor contraction the blood flows slowly, and then clot starts to form. Okay? Valve regurgitation. As the ventricles enlarge, mitral valves. Hi Nafula, welcome. Fiona is saying hi to Nafula. You see, valve regurgitation means blood is coming, instead of blood going in front, it is coming backwards. These valves are made to, when blood is passing, blood should not come back. When it's coming back, they block. So blood, it is called non-return valve. It should not come back, it should go. So it means that when you have these problems and the heart are instead of them blocking, they are opened like this. They are opened like this. So when you pump blood, they do this. The normal is supposed to be here like this. So when you pump blood, they open, they come back. You see? But when the heart is dilated, they are doing like this. So heart, the non-return valves are not doing good job. Cardiogenic shock occurs if that failure cannot maintain adequate circulation. They cannot maintain adequate circulation. You see? So you see how dilated cardiomyopathy, people go to hospital. You go to hospital, you are given drugs. You have not done an ECG. Those people that like going to over-the-counter medication, the people that say, it's just chest pain, or the people that say, I suffer from pressure, heart pressure. They say heart pressure. So when I go to over-the-counter, I get those heart medication, the pressure medication. Everything becomes okay. My friend, don't dare do that one. When you feel headache, and one day you take your BPs, the second day it is still high, go to a physician. Let a physician do his work. But we usually say the great physician. Who is the great physician, my people? Who is the great physician? Please say you know him. Who is the great physician? Let me get the answer. Do you know who is the great physician? Now, we do ECG to get sinus tachycardia, left bundle block, atrial fibrillation, and ventricular ectopic beats. We do to check for if there is a block in your heart, fibrillations, if your heart is beating so fast, or tachycardia. Greetings, Sha Travels and Fiona. Hey, Fiona, Fiona from Uganda. Yes, sir. Yes, a very humble lady. Who knows who is the great physician? Do you know who is the great physician? And if you do a chest X-ray, a normal chest X-ray, you will find an enlarged heart, pulmonary edema, and pleural effusion. Pulmonary edema means the lungs plus the pipe that takes blood to the lungs is swollen. Echocardiograph to check dilated ventricles. So we do some blood tests like liver function, we do like thyroid function, we do like iron studies, viral studies to see if it is a virus or a bacteria which is eating your heart. And if we do something like troponin, we know your heart is suffering when it is elevated. BN or TN. There are so many things we do in the laboratory, or we check the valves by doing coronary angiography, and then we do genetic testing. We do genetic testing to see if it is a problem that you've carried from your genetics. So you who is here, you don't want this, what do you, how can you live so that you cannot get this problem? Stop smoking. Stop smoking. Avoid alcohol. Reduce salt intake. Maintain a healthy weight. Exercise as recommended. Always exercise as recommended. And get recommended vaccinations like such as flu. Don't fail to take your children to get vaccinated. Please don't fail to take your children to get vaccinated. It helps a lot. Vaccinations helps a lot to get away with these problems. Now, before I continue to clear this topic, who has a question? Who has a question, my friends, before I finish this topic? Today I've come late and it's going to 7 p.m. here. It is going to 7 p.m. here. And me, for me, my lives are always 1 hour, 1.5 hours, 1 hour, and then I'm finished. So any question that comes, I'm inviting anyone who has a question. I'm checking on this thing. But smoking and alcohol, you have seen smoking and alcohol is bringing so many things. So many complications are brought by smoking and alcohol. And so, when you come to a hospital and we check, we find that you're having this problem. What do? What we usually do, we put you on some medications like hypertensive drugs, to reduce the high blood pressure, so that you cannot get a problem, of the heart stretching more. Hypertension stretches the heart. So we have another thing here that is called the coffee cakes. Coffee cakes. Hi, how are you doing, coffee cakes? There are some implanted devices, like implanted cardiovata. There are some people who have this implanted device. Severely reduce ejection fraction despite optimal medical therapy. So you find that even if we are given drugs, the heart has really stretched and they cannot pump blood. So you are added a device to help the electricity to be more, so that the heart can pump. It is called implanted cardiovata defibrillator. Cardiac synchronization therapy. There are some people who live with these devices, and they live well, and it works good. It makes your heart pump better and normal. Just adding that device, they are called cardiac synchronizer therapy, and they are advanced treatment, mechanical circulation, left ventricular assistance device, given a device that helps the blood to circulate. How can you control this problem? Because you can't live with them, you have to controlling high blood pressure, managing diabetes, avoiding excessive alcohol and illicit drugs, treating viral infections and myocarditis, and promptly when appropriate. Eating healthy diet, avoid smoking. So, dilated cardiomyopathy is characterized by enlargement and weakening of the heart muscles, leading to reduced pumping ability. It is the major cause of heart failure. Most heart failures have this problem. Arrhythmias, this is the problem. Stroke and sudden cardiac death. People that live with high blood pressure and they don't want to take drugs, you get sudden cardiac death. You create your own cardiomyopathy, you see, and when it comes, you know what happens. So, modern treatment combines lifestyle changes, guidelines, all of them. So today I will not stay for long. Oh, it's already 7 and I'm saying I will not stay for long. Unless anyone has a question. Anyone with any question? Before I check out. But I feel tired today. Waking up at 3 a.m. and walking around till now it's not a joke, right? But now I can rest now. Now that I've talked to my people, I feel relieved. Anyone who has a question? Okay, bye bye. Let's meet tomorrow and we discuss how to treat this heart condition, dilated cardiomyopathy. Let's meet tomorrow and discuss how we can treat dilated cardiomyopathy. So, have a nice day and be blessed, everyone who has fair coffee cake. Everyone who has been watching, unless if you have any question, if anyone who has a question, let me check. Okay, bye. See you guys.